Dr. Joseph Kanu understands that one way we can honor God is by being as healthy as possible. Dr. Joe believes modern science proves the healing abilities of remedies found in Scripture, and as a practicing chiropractor, blends those biblical truths with cutting-edge technology to enrich his patients' lives physically, emotionally, and spiritually. Welcome to Simple Truths for Healthy Living with Dr. Joseph Kanu. Listen for the next 30 minutes as Dr. Joe shares tips to help you live the healthy life God intends for you. And now your host, Dr. Joe.
Well, good evening. This is Dr. Joseph Kanu broadcasting live from Rochester Chiropractic Clinic, and we have a great guest on tonight. It's Haddad Nights with Dr. Jeff Haddad. Welcome to the show, Jeff.
Just a special glimmer in your eye tonight. I missed you, though. I did miss you because I was out of town for a little bit, and it is great to be back, as always. So thank you. It's good to be back.
Yeah, welcome back, Jeff. Welcome back. It's great to see you, too. I don't know if the listeners realize we pre-recorded your last show, so...
Yep, we did, and it was a good one, and we were going to follow up a little bit on that stuff, because coincidentally... I've learned some new information.
Oh, wow.
Since then, and I think the good Lord was actually listening, because I was actually lecturing last weekend at a conference, and they touched on some of the stuff that we touched on, actual research that just came out in February of this year. Confirming some of the things that we talked about last week. So
is that right? So you were in the spirit last show when we were talking about...
That's correct, about how clenching your teeth at night, most people think it's due to stress and, just a stressed out life, when in reality, it's been proven that, and we touched on that, about our thoughts about how it was related to sleep apnea and airway.
Your airway, trying to keep force your airway open.
Correct, and it's unbelievable.
That was pretty exciting.
Well, and it was more exciting for me at this conference.
To think that's why you're doing it.
Right, and again, you and I talked about it, and you said, wow, I've never really heard that. And this neurologist and sleep disorder specialist was a lecturer, as I was, at this conference, and his research proved that your clenching actually prevents your airway from collapsing at night, literally giving your body this defense mechanism of staying alive and breathing. Sure. And it's eye-opening.
An involuntary reflex.
You got it. And it was. I was sitting there and I listened to it, and all I'm thinking about is I can't wait for the next show, because Dr. Joe is going to love this, because it's nice when science backs up some of these, I guess associations,
clinical findings.
Right. And it was great.
Yeah.
It was great. I had a great time, and I loved to lecture. I loved to educate, and it was a fun weekend, and the conference was just enlightening. I lectured the very first day.
So you actually lectured as well.
I did. I was one of the guest lecturers. Correct.
As well as going to classes.
Correct. It was a busy weekend, but I spoke to about 120 dentists, and it went very well.
Are you nervous when you do that, Jeff?
I used to be, and I don't anymore. I love.
You're nervous with me.
You can tell.
I can tell.
You?
Yeah.
I think you make everybody nervous.
But not in front of 120 dentists, right?
I think that really I stopped being nervous when you really know, first of all, when you're passionate about what you know and believe, and it's not you trying to remember things, just things that you know and things that you've seen in your practice, and you're talking about life experiences with your own patients, it becomes easy. And I think that's why this show flows as well as it does, because we just speak freely about the things that we know, the things that maybe we learn, and things that we see in our everyday practice. So we're proving it with our own patients, and it's good to share it with either, whether it be your colleagues or whether it be with other patients. It's nice to share those experiences. So it was a great overall weekend. I lectured the first day, so any pressure on me was off, and then after that it was just me learning. And I'll tell you, a bunch of our show tonight, I'm going to tell you more of what I learned that had to do with actually orthodontics. And I know you're thinking,
orthodontics,
wait a second,
Jeff. Now that's cosmetics again.
Okay,
now
I knew you were gonna say that.
Don't you know there's a war going on? I don't want to hear about cosmetics, pal.
You know, I thought I'd have to set that up more, but you just see it. It was hook, line, and sinker there. I knew you were going to say that, and I'm glad because most people think like you do. Orthodontics. Let's straighten our teeth so we look beautiful. Vanity things.
Vanity. All is.
It is a bad sin, and I'm going to tell you, I am going to dispel that myth because this was eye-opening for me too. In all seriousness. Yeah. Crooked teeth, you'd think, oh, whatever, I just want to make them look nice. There is so much research proving and showing that having crooked teeth and having a misaligned bite actually affects your overall health. Not only the health of your teeth, but your overall health. It's
crooked teeth are affected.
I know. It's hard to believe, but that is the stuff we want to talk about tonight.
Hey, Jeff, let's, like you said, the show flows. It's already flowing. But you know what? Usually this show flows because we get in the spirit.
Right. Yeah.
So let's go to a reading.
All right.
So that was the pre-intro.
Oh, I like the teaser.
Okay.
People are on the edge of their seats.
So this reading, we're going to start the show with our reading from Hebrews. And, the purpose of our show, as always, is to gain more knowledge, for the Lord's people suffer and are dying and are perishing for lack of knowledge and wisdom. But so we're going to start our show with chapter 13 in Hebrews, verse 1. Let mutual love continue. Do not neglect hospitality, for through it some have unknowingly entertained angels. Be mindful of prisoners as if sharing their imprisonment, and of the ill-treated as of yourselves, for you also are in the body. I love that some of us have entertained angels and not known it. If you ever think about that, that's pretty intense. And hospitality is so important. And Jeff, you are very hospitable. Tell you,
Thank you.
One of your great attributes.
I appreciate that.
Amongst any. And Lord, we ask that this show would flow, that we would talk about your will and your wisdom would bestow upon our lips, that your Holy Spirit give us utterance and open the minds and hearts of the listeners, that they may gain knowledge and better health so we can serve people to a greater capacity and be more hospitable and show more love and be able to visit those in prison and do all that. That's it, baby.
I like it.
Yep. So you lectured. You said you were at a lecture, but you also gave a lecture.
Correct.
So I've heard of the doctor's doctor, but that was like the dentist, right?
Right. Yeah, it was a conference really focused on sleep disorders and how medicine and dentistry are coming together on
together. And then it was kind of a confirmation of what we talked about last show. Right?
The timing was impeccable. I couldn't believe it. And then the other part of it was, like we talked about earlier, orthodontics and how developing the jaws properly, not only in children, which we've touched on many shows. I mean, children whose teeth are not addressed from a developmental standpoint, their jaws develop improperly, and they become these TMJ disorder people or these sleep apnea people because early on there wasn't any intervention. So there was a lot of that, and then there was a lot of talk about adult orthodontics and how...
Could you back up on that?
Sure.
With kids who are heading towards becoming sleep apnea in the future,
right?
What is their issues as a child?
A lot of times it's underdeveloped jaws, especially the lower one. You've got a what we call a retruded mandible, which means that your lower jaw is pushed back towards your ears.
Right.
Okay.
And on a side profile.
That's correct.
You look at it, the jaw's pushed in.
Exactly. And I mean, you think about that. That's not comfortable for anybody. But if a child's jaw is not allowed to grow because of interferences or improperly developed upper jaw or your maxilla, then you're going to have an airway issue there because think about it. If you push your chin back, what's getting cut off? It's tough to breathe that way, right?
It's tough to breathe.
Okay,
yes.
and so that's one thing.
Try that out there, everybody.
Yeah,
Push your jaw in.
It's not fun.
And it's not.
And there are people
Look
living
at
like
the
that.
faces people are making. We should come here.
I know. You
But
wish
anyway.
this was television. But it's with technology, we could have everybody with their iPhones. We could probably see them.
Yeah.
But it is early on in life, these kids don't stand a chance unless some intervention happens, whether that be addressing their jaw development, their upper palate, which is a very important indicator. These people that have very narrow palates, their upper jaw is very narrow. There's not much room for a tongue in there. There's not much room for an airway. It's a downward spiral there. So they touch on early intervention with children as early as 6 years old, 6 to 8 years old, and using just very simple appliances that are not painful for the child. They kind of like it, to be honest. They think it's fun. It's what we call a rapid maxillary expander, and we're literally expanding their palate so that there's enough room for the lower jaw to grow and develop properly. Yeah, it's really.
So they get in there with a
little crank.
Give it a crank or two.
You got to crank it 2 a week, and they will move about a millimeter every, I believe it was 6 weeks ish, 4 to 6 weeks. And there's some parameters there that I won't bore the listeners with, but we can measure a child's molar to molar on their palate, and at their age, it should be within a certain range. And if it's not, we need to intervene. And we intervene, and then we get them to that normalcy. And when they're 12, and let's say they still need orthodontics, it's like 1 year of braces, as opposed to, you've heard horror stories of 3 to 4 years.
3 to 4 years.
That's because they weren't.
They get
intervention
off the braces, it goes back.
You got it.
Got to get in.
Yeah, and I'm glad you touched on that. That's what we're going to talk about tonight. There are so many listeners right now, and I guess myself included, that have had orthodontics as children. They've got relatively straight teeth, but things aren't perfect. Things aren't what they used to be. There's a relapse.
So orthodontics, can you give me a good definition of
orthodontics? Braces is traditional orthodontics.
Okay.
You put braces, brackets, and wires that are usually on the upper and the lower teeth, and they're straightening teeth into the proper position and proper bite. We're going to talk about some newer things that are not braces, because a lot of adults want to avoid that, and I don't agree with it, because I think orthodontics is a great treatment for people, and I believe that you're never too old to do orthodontics. Yeah. I have a little.
How old is too old?
Well, I don't know if there's a too old. I can tell you right now that my wife's grandfather.
Okay.
All right, Grandpa Wolski.
I like him already.
He's a good man, and when he was 65 years old, he had braces put on. He's 86 now. He's got better teeth than you and I put together.
Wow.
And he loves everything about it. And I give him so much credit, because it wasn't too late for him. He had 8 daughters. They all got orthodontics. Well, he couldn't afford it for himself, so he had to wait till he was 65. But he
was the 9th one.
You got it.
Through, right?
The 9th wonder of the family. Yeah, and so I really try to tell people that, but still, there are a lot of adults that just are against it, and I don't fault them for that. I mean, I can see some of you self-conscious being in braces. So there's some other ways, which I'm not going to tell you right now. We're going to get to a little bit later.
We're going to get to it.
But they're faster. Okay. They're not even visible to a degree during the day, and some of them you don't even have to wear during the day. You can only wear them at night, and they move your teeth at night. And I actually was a candidate for that, and I went through that. So we're going to touch on all that tonight. Hey,
Jeff, tell me, when you were talking about the upper palate, okay, the maxilla is the upper palate between your nose. Well, behind your nose is the maxilla, and the upper teeth, the upper palate.
Correct.
Right. So now, thumb suckers.
Ooh, good one.
What does that actually help expand the upper palate, or what problems? Or
I'm so glad you brought. Yeah. Look at you coming out of left field.
I know
with
that's
that
kind
one.
of a
no, that's a good one though. Thumb sucking is about the most detrimental thing you could do to your palate. It's the worst thing. In fact, it will form it. It will deform it. Okay, you will get what's called a vaulted palate. It'll actually make it a deep, high,
arc.
and narrow palate. You'll have a child that has what we call an anterior open bite, or a open bite. When they bite together on their back teeth, you could see in between their upper and their lower teeth. That's not normal. That's when intervention is very important, and we need to stop the thumb sucking, first of all, the root cause, okay?
Right.
And we need to develop that palate properly, because a thumb sucker, if that's not addressed, a myriad of problems in the future. I mean, there's
how many
countless.
kids? I remember when I was a kid, we saw a lot of thumb suckers.
Mm-hmm.
I did as a kid,
right,
in my neighborhood, and I mean, are kids still doing that a lot?
They do.
Do you see?
They do. I mean, I think there's more education that parents try to get their children out of that habit. So I think before people didn't know it was a bad thing by any means, but now they know it's a bad thing and they will intervene. But I mean, I'll tell you, the stat is that 74% of Americans have what we call a malocclusion, which is crooked teeth,
malocclusion,
a bad bite, all encompassing. 74%.
That's a lot.
I mean, it's
well over half.
Yeah,
I mean, it's
3 out of 4 people, right?
Yeah,
and so, and again, I know the listeners right now are going, "Yep, that's me." That's me, because the majority of adults, even if they've had orthodontics, they relapse. And the crooked teeth thing, from a mechanical issue, we talk about. We said this isn't for cosmetics. Well, what are the problems? First of all, if you have a mechanical issue, meaning if your teeth are not coming together properly, you're going to have abnormal stresses on certain teeth. Abnormal wear, abnormal tear, wearing down of teeth, fractures of teeth.
Oh,
are you familiar with what's called an abfraction?
No.
Okay, an abfraction, and I know everybody knows what it is, but that's the clinical term. The little notches along the gum line of your teeth, usually on your side teeth, usually associated with gum recession, okay?
Mm-hmm.
Yeah, I'm sure you know what I'm talking about, right? That's called an abfraction. And it's amazing to me, but there's a lot of patients that have been told over the years that that's from brushing too hard.
Brushing too hard?
Have you heard that?
I was told that too. Don't brush too hard. You wear your enamel off.
Correct.
My dentist told me that.
It's so unfortunate, because that's really a dental myth, and it's an old, disproven dental myth. Think about this. If you took a toothbrush to your leg bone, do you think you could brush it away?
No way.
Right?
No way.
Did you know that enamel's stronger than your bone?
Wow.
It's the strongest substance on your body. So
I thought my head was.
Well, yours maybe. Yours possibly. You're just an anomaly. But I mean that, and so it's not even possible. What it is a mechanical problem. If you've got a tooth that's held in by bone, okay? Right. Think about the tooth above the gum. That's the crown of your tooth. Below that is bone that's holding in your root.
Bone, right.
If you've got your teeth interlocking like gears, there's torque there. Well, if it's abnormal torque or too much stress, you're going to have a lot of unnatural stresses on a few teeth that's going to literally bend the tooth.
Where the tooth anchors into the bone.
Exactly. Imagine this. I got an analogy I just came up with. Let's say you have a pole and you just sink it into cement.
Now you're talking.
Okay.
I'm Italian. You start talking cement.
All right.
Cement, and now I get it. Okay.
The Italian loves it. Okay. So, all right, think about that.
Okay. You got a pole in cement.
Okay. And the pole above the cement is the crown of your tooth. It's the white tooth that you see in your mouth. Okay. Below is the root of your tooth.
Okay.
Okay. The cement is your bone level and your gum level. And you take a sledgehammer to the side of it and you're hitting it.
Oh, boy.
What happens? The cement cracks, right?
It
cracks away.
In the cement.
That's what happens. Your tooth is literally flaking away, fracturing at the gum line, causing these notches.
Boy, you paint a picture, Doc.
I hope so. Well, it's radio.
Yes,
we have to,
this is great.
So it's television, I can draw a diagram.
I understand that. So it's flaking away, cracking.
And so that's the mechanical issues with crooked teeth. If your teeth are properly positioned and your bite is balanced, your teeth are going to last a lot longer. You're going to avoid a lot of costly dental work because you fracture a tooth, as you know and I know, gets
so this isn't
expensive.
Just cosmetics, no.
Not even close. And that's just the mechanical part of it.
Okay.
We haven't even touched on the systemic and the disease part of it.
I definitely want to get to that.
Okay. Well, we will do
Let's take a caller.
Okay.
I've got a caller. Hi, Archie. You are live and on the air with Dr. Jeff Haddad.
Yeah, Dr.
Welcome to the show.
listen to you guys all the time. Thank you for putting on a wonderful show. Just had a question for Dr. Haddad in regards to sports mouth guards. Is it better to get one custom made by a dentist, or is there one out there I can buy, just at the drugstore that's a good brand that you recommend for?
Boy, that's a great question, Archie.
That's a very good question.
So do you just get one from the store, or do you get one custom made, or is there a good one at the store? It's
I've seen some good ones. I equate it to, we've talked about whitening in the past. We've talked about even bite guards in the past. Unfortunately, anything you buy over the counter is, a made for all,
right.
One size fits all.
It's like a shoe.
Right.
And your foot, right?
Correct.
One shoe doesn't fit every
personally,
foot.
Your teeth are very precious, and I personally, and making custom mouth guards, it's not expensive. There's some out there that are very expensive. I mean, you could find mouth guards out there amazingly for up to $500 if you can believe that. Anywhere from $10 to $500, and wow. I'm not suggesting you go out and buy a $500 one. However, there is a lot in the middle of that. And
how much can you make one for? What's the cheapest that?
Honestly, I would probably for a good one at a dentist, I would probably I'm gonna guess I would say anywhere from say $50 to $75.
No, that's not that
you would get
much.
A very good custom fit one
because it would last a while.
Absolutely, right? And Archie, to answer your question, I believe that a custom fit anything is better, whether it be a mouth guard, whether it be a shoe orthotic, anything. So it's not that the ones over the counter don't work. They can, but are you going to take a chance?
It's better than nothing.
It's better. Oh, absolutely.
Better than nothing.
No question about it.
Archie, do you play hockey?
I do. And we
plays hockey.
We wear
so
that just for safety, so we don't chip
So now it's better than...
Absolutely.
You know what? So you don't chip a tooth, but do you know, Archie, really it helps for concussion, right, Doc?
Right.
The bottom jaw slamming into the upper causes, and the mouth guard helps, right? To prevent anyone, but now it might prevent the concussion, but it can cause, I would think, jaw problems. TMJ issues if the mouth guard wasn't a custom fit.
You're absolutely, and I see patients do that all the time. I can tell you this.
This is a great question.
It is. An overall statement is this: if you're not wearing some sort of mouth guard, you are playing with fire, and it's not about just chipping a tooth. I love the fact that you brought up a TMJ issue or a concussion. There's a lot of serious things that happen, and I played hockey my whole life. Not only did I have a mouth guard, but I had the cage and then the eye tech. I mean, I had it all. And I'm so glad I did. And I had other people that truly, almost made fun of me to a degree that I was, had my cage on. It's like, listen, and they have, either less teeth than me or not as nice a teeth than me now. But, a custom mouth guard, in my opinion, is priceless because if it prevents, breaking your teeth out, preventing a concussion, preventing a TMJ joint problem, believe me, you're going to get your money's worth. So I recommend spending the money on it. I agree.
Well,
and that's what I would
$75.
Yeah.
If you're going to play, you got to pay. Yep.
Hey, thanks, Archie. That was a great question.
Hey, so Jeff, now you were starting when you said cosmetics and the crooked teeth. I didn't want to really hear about it, but now you're kind of getting me there when you talked about the pole and the cement and it's wearing out the jaw bone. It's causing problems, but how does it, and of course causes chipping and some excessive wear,
right?
But how is it going to cause diseases, and what kind of diseases are you talking about?
What we are talking about, and we've touched on it in other shows, is gum disease. Crooked teeth are very difficult to keep clean. Okay? Very difficult.
That's understandable.
Not only are they difficult to keep clean, but they actually trap bacteria more so than straighter teeth do.
Okay.
What does that do? Well, it leads to gum disease, bleeding gums.
You're more
redness,
vulnerable.
Much more. It's a proven fact that people with crooked teeth can't keep their teeth as clean as somebody with a nice straight smile. Now, what does that do? Well, starts off with a little, what we call gingivitis, which is some inflammation of the gums, some redness. Then it progresses to bleeding gums. Please listen to this statement. If your gums bleed when you brush your teeth or floss, there's disease present. Healthy gums do not bleed, okay? Unless you're using fishing line
Even
with
after
floss.
Floss.
I
When
mean,
you floss your gums.
and you better, if you're getting aggressive, anything's gonna, be damaged.
Okay.
But no, if you're just doing normal flossing, there should be no bleeding at all. And what happens when you have periodontitis, which is gum disease? That is the same type of bacteria, same plaques in your mouth, travel to the heart, travel in the bloodstream, and lead to heart disease, increased chance of stroke, correct, diabetes, and I know you can appreciate this, a weakened immune system. How many patients have you?
Definitely a weakened immune system. Like some of your patients that I've sent to you that have an abscess and it's a low grade, they don't know it.
You got it.
Yeah.
I mean, that's it. And so, like, when
even that the young actress that was in Sarah.
Right.
Holden.
Correct.
Right? Who had it, didn't know it. She was probably had a weakened immune system for
who knows how long, right?
Right, before it really blew.
And that's really and that's why I think that, and again, this was a topic at this conference that I was speaking at, and I thought it was such a great educational thing for, again, a person like yourself and other people out there who just think orthodontics and straighten your teeth is just for, vanity reasons, when really it's a true health problem here. I'm going to lead right into how we fixed some of these things without braces, because I was a candidate for this specific appliance. It's called an Inman aligner. My lower teeth, which is very common, were very crowded. Even though I had orthodontics, my upper teeth are straight. My lower teeth were crowded. Many people have that.
Okay.
I wore this appliance when I got home from work, slept with it. Within 2 months, I mean, I know the listeners can't see, but you can take a look at my teeth, Dr. Joe. They're pretty perfectly straight.
Yeah.
And I'm going to tell you,
great.
in 2 months, I went from crooked lower teeth to essentially perfectly straight teeth.
Wow.
And nobody even knew I was doing
2 months.
2 months. I mean, it's an average of 2 to 4 months with these appliances.
So this is just something, it's like a mouth guard?
It's similar to a retainer, but it's, again, better technology, right? Nickel titanium, good mechanics, good engineering, and this is an appliance that's really not that old. Probably within the last 5-7 years, it was invented, and just now it's starting to be used more. We've been using it in our practice for probably the last year and a half, and the results we're getting is unbelievable. And it's for patients who won't wear braces. I'm not going to wear braces. What else do you have for me, Doc? It's a great option.
A great option.
Another option that I'm going to leave you with real quickly would be Invisalign, which is worn all day, but they're invisible retainers that, again, move teeth. And, if people would like to know a little bit more information about this, I know we're running out of time here.
Yes.
My website, which we just revamped, and I'm very proud we have all our show archives on there as well, is at RochesterAdvancedDentistry.com. You can call our office at 248-656-2020 for any more information on any of the things that we talked about tonight.
Okay. Well, thanks, Doc. So now we know crooked teeth can cause major health issues besides wear and tear, and there's something you can do besides wear braces. We should cover that in more detail next week.
We can do that.
Okay. And you can listen to this show, SimpleTruthsForHealthyLiving.com or RochesterAdvancedDentistry.com to get a hold of Dr. Haddad. And remember that in all that you do, eat, or drink, do all things to the glory of God. Next Wednesday, we'll have Dr. Jeff back to talk more about how to treat it. Okay? Have a beautiful night's sleep. See you tomorrow night.
You've been listening to Simple Truths for Healthy Living with Dr. Joseph Kanu. If you'd like to talk with Dr. Joe, call 248-656-1011. That's 248-656-1011. And tune in again Monday through Friday from 10:30 to 11 for another edition of Simple Truths for Healthy Living with Dr. Joseph Kanu.
The content on this program is for sharing general information purposes only. It is subject to change with ongoing research. It is not meant to diagnose, treat, prevent, or cure anything. Dr. Kanu encourages you to make your own healthcare decisions based upon your own research and in partnership with a qualified healthcare professional of your choice.